The Honourable Minister of Economic and Rural Development.
Thank you, Mr. Speaker. Mr. Speaker, you know, I've already said in this House the number of jobs that this government has created, the number of investments that this government has made in Nova Scotians, and the number of jobs that have been maintained and or created in the province of Nova Scotia since June of 2009 are somewhere close to the area of 10,000, Mr. Speaker. Mr. Speaker, those are a lot of jobs. And through economic and rural development, NSBI, IEF, Mr. Speaker, we have maintained and created jobs, and we will continue to do that.
The Honourable Member for Hants West on your final supplementary.
Mr. Speaker, in a competitive global economy, Nova Scotia must compete for business and skilled workers if we have any chance of achieving meaningful economic growth moving forward. Unfortunately, Mr. Speaker, the state of the province is not conducive to the future success when we have a government that does not see the harm that increasing taxes does to our economy. Mr. Speaker, through you to the Minister, when will this government finally realize that the way to meaningful job growth in Nova Scotia is through a competitive business environment with low overall tax burdens and not through adding levels of expensive bureaucracy?
The Honourable Minister of Economic and Rural Development.
Thank you, Mr. Speaker. Mr. Speaker, again, a couple things that I have to say. First of all, I congratulate the member opposite for getting it partly right, because he mentioned in his question, he talked about competitiveness. And Mr. Speaker, if he reads the document, Jobs Here, he will see and he will understand, I'm sure he will understand, that being competitive is part of what Jobs Here is all about. Mr. Speaker, if we are going to advance the province of Nova Scotia, we have to be competitive. And I think, just by the way that he asks the question, by mentioning that, he realizes the importance of that. Mr. Speaker, if he doesn't, I'd be more than willing, Mr. Speaker, I'd be more than willing, Mr. Speaker, to sit down with him at any time and explain to him the full details of Jobs Here.
The Honourable Member for Dartmouth North.
Thank you, Mr. Speaker. Today, my question's for the Minister of Community Services. Mr. Speaker, I'm going to paint a little bit of a picture here of reality of what people on income assistance are dealing with in today's society. A single person currently on income assistance who would be considered disabled or dealing with a disorder currently receives $5.35 for a shelter rate and $2.14 for a personal allowance. Now, in my neighbourhood, Mr. Speaker, a somewhat decent, somewhat safe part of the community will cost you about $600 for your rent. So if you break that down, that extra $65 has to come from something, and it comes from a personal allowance. So if we take that $65 off the $2.14, it brings it down to $149. Mr. Speaker, that individual needs a phone as well. And let's break that down to about $30. That individual now has $119 in their pocket. Power, and power is going up, Mr. Speaker, but let's put an average number out there of $40. So that individual now at the end of the month has $79 in their pocket to do their shopping. So my first question to the Minister is, does she think it's fair for income assistance recipients to be shopping at food banks instead of grocery stores?
The Honourable Minister of Community Services.
Thank you very much, Mr. Speaker, and thank you to the Honourable Member for his question. No, I think that the way things are in today's world are very difficult. And each and every day I struggle with those numbers that he has presented. And at the same time, our government has seen that there are these issues that have accumulated over many years and have been somewhat neglected. And therefore, that's why we brought in the affordable tax credit, the poverty tax credit. We're making changes to income assistance. We're making steps forward. They're not all of what we want, but what we are doing is that we recognize that it is truly an issue and we want to make a difference. Thank you.
The Honourable Member for Dartmouth North on your first supplementary.
Well, Mr. Speaker, Canada is not exactly doing well either. Canada is currently one of the top 30 developing countries in the world. However, its need to support the social safety net isn't quite up to par. Currently, Canada ranks 26th out of 27th with funding for early childhood education. Social assistance, 22nd out of 29 countries. Unemployment insurance benefits, 23 out of 28 countries. Benefits and services for persons with disabilities, 27 out of 29th, and supports for families, 25 out of 29th. So my second question for the minister is, what exactly is your government doing to show and lead the rest of Canada in the fact that you believe that you are truly contributing to a sharing and caring society in Nova Scotia?
The Honourable Minister of Community Services.
Thank you very much, Mr. Speaker. What I would like to say is that we have done many things in the short period of time that we've been here as a government. Number one, we have been talking to people. We have been out at the grassroots level to discover what those issues are, what exactly have affected individuals, not only on the issues of shelter rates and IA. What we have been talking about, are there better ways for us to do services to them, for them, and work with them? And I think that shows our compassion and what we want to do. We have come forth and we've made changes, as I talked about many times, is the affordable tax credit, the poverty tax credit. That's a $72 million investment that we made within our first year as a government. We have taken the tax off of clothing for children. There are many, many, many issues, and we are working away at each and every one of them to see what we can do to make a better and a more affordable life for Nova Scotians.
The Honourable Member for Dartmouth North on your final supplementary.
Well, Mr. Speaker, over the years we've been assured that a rising tide lifts all boats. That is that it's necessary to give to the rich, and that will in turn enrich the poor. However, the consequences, Mr. Speaker, have been disastrous, both for the planet and those individuals who haven't had a chance to have their boat risen. So the Minister of Economic Development stood in the House earlier and suggested that his government wants to invest in people. So I'm wondering, my final question for the Minister, if she can answer me and tell me exactly where she figures that 5% cut in her department is going to come if it's not on the backs of low-income Nova Scotians.
The Honourable Minister of Community Services.
Thank you very much. I think that one of the struggles, we know we have to live within our means. We know that we have a huge challenge financially, but I think what the difference is that the Honourable Member knows, I know he knows this, is the fact that we are inviting a discussion with people and we are looking at what ways can we go forward that we do not, through cuts that we have to make, affect those people that need it the most. So there's different ways that we can be more creative. We also have to look at the services we provide. We have to look at ourselves as departments and governments. Are there better ways that we can be doing business so it's not on the backs of those who need it the most? And lastly, I think the most important thing is we have to work together, the opposition, the government, the community, and the corporate level. This is not an issue for one to try to resolve. This is an issue for all of us as human beings to come together and help others. Thank you.
The Honourable Member for Bedford Birch Cove.
Mr. Speaker, I've received several phone calls from concerned parents in my riding who have been told a new provincial policy on the administration of insulin in schools is imminent. It should be noted that the policy on this currently varies from school board to school board, and we've been told this policy will be a joint announcement with the Ministers of Health and Education. My question is to the Minister of Health. What institutions, groups, and/or organizations have you consulted with in the preparation of this new policy?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and I want to thank the Honourable Member for the question. It is the case that the Departments of Health and Education have been working collaboratively with a number of our partners, looking at some standardization in terms of the provision of good quality supports for students in our school system. Students, for example, with juvenile diabetes who require the administration of medications such as insulin during the school day to ensure that kids are well taken care of when they're away from their families, Mr. Speaker.
The honourable member for Bedford Birch Cove on your first supplementary.
Mr. Speaker, these parents are concerned their child will not be able to receive her insulin injections at school once this new policy is announced, even though her EPA and her backup are trained to do so. So my question is now to the Minister of Education. Can you guarantee that students who currently receive insulin injections in schools will continue receiving those life-saving injections at school once the new policy is implemented?
I'm sorry, your question was to the Minister of Education, the Honourable Minister of Education.
I have to admit that I haven't had a briefing on all the details of the work that the staff of the department has been doing with the staff of the Department of Health. Certainly, looking with health professionals to provide the best possible standard of health services to allow students with health conditions to have full access to public education is a priority. And I'll certainly have to get more information on that. And I would be pleased once the announcement is made to have staff sit down with you and me, and you can ask any questions you have to alleviate the concerns of the constituents that you refer to. Thank you.
The honourable member for Bedford Birch Cove on your final supplementary.
Mr. Speaker, I would hope the ministers will release the details of this new policy soon, say within the next 2 weeks, so it can be subjected to the scrutiny of the House. Because, Mr. Speaker, these parents are pretty stressed out about this impending announcement, and I think all of us here who are parents can understand their feelings. To reassure them, can the Minister of Health please indicate what this new policy will be, and if she will not, when can we expect an announcement?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. Mr. Speaker, what I can say is that parents with children, for example, children with type 1 diabetes, should feel absolutely secure that there will not be any significant changes that would negatively impact their kids, that our concerns are that they get the very best care while they're in a school environment that corresponds with their health needs. The policy is developed to ensure that this will be the case, and certainly children who require, for example, insulin injections will in fact continue to get insulin injections without inconveniencing the parents or the families. We understand this issue. Our concern is to ensure there is better health care, more consistent standards, and families can feel very reassured. Thank you, Mr. Speaker.
The honourable member for Glace Bay.
Mr. Speaker, today several individuals were at the House advocating for government action to address poverty issues. In 2009, the Department of Community Services introduced the Poverty Reduction Strategy. The department appeared before the Community Services Committee on November 3, 2009 and March 2, 2010 to give updates on the strategy's implementation. So my question, is the Minister of Community Services committed to implementing the goals and objectives of this strategy?
The Honourable Minister of Community Services.
Thank you very much, Mr. Speaker, and thank you from the honourable member. And he'll be very happy to know that every day I work towards accomplishing strategies, looking at new ways of doing things, of looking at what we've consulted with individuals about in order to be able to help Nova Scotians, and this government is committed every day to work towards those goals. Thank you.
The honourable member for Glace Bay on your first supplementary.
Mr. Speaker, one objective of Nova Scotia's poverty reduction strategy is to prepare for the future through training and education. It goes on to say, quote, "One of the barriers of continuing education is affordability," unquote. The strategy credits the tuition freeze as a way of reducing barriers to higher education. My question to the Minister of Community Services, does she stand by these statements in the poverty reduction strategy?
The Honourable Minister of Community Services.
Thank you, Mr. Speaker, and I would like to thank the honourable member for his questions, because I know he cares too, the same as I do and the same as this government does. And for example, the Target 100 that we spoke about the other day is a program that is looking at assisting individuals to get into the workforce and actually get very higher level positions. The whole aspect we do understand, and we know that that we must work closely in terms of looking at what the needs are for each individual in order to assist them to get into the workforce and to get good jobs for today and for their future. Thank you.
The honourable member for Glace Bay on your final supplementary.
Thank you, Mr. Speaker. It appears the NDP government is going to raise tuition, although we certainly hope not. The Premier and the Planning and Priorities Committee don't seem to understand that investments in education give individuals the ability to be successful and lift themselves out of poverty. Will the Minister of Community Services ask the Premier and her colleagues to maintain the cap on tuition to help ensure access to post-secondary education?
The Honourable Minister of Community Services.
Thank you very much, Mr. Speaker. One of the things I want the honourable member to be aware of is the fact that through community services that we do assist those who are on income assistance to go for further education, whether it's in the community colleges or through the universities. So we identify if they are wanting to further their education, and we encourage them and we support them financially to do that. Thank you.
The honourable member for Hants West.
Thank you, Mr. Speaker. Mr. Speaker, my question through you is to the Minister of Agriculture. The Minister of Agriculture has announced he will be releasing his 10-year agriculture plan to the industry tomorrow afternoon at 4:30 at the Nova Scotia Federation of Agriculture's annual general meeting in Truro. Agriculture employment, according to your Department of Labour and Workforce, is expected to decrease by 2014. Will Friday's strategy contain anything new to lessen the impact of the NDP's negative strategies?
The Honourable Minister of Agriculture.
Mr. Speaker, there are no NDP negative strategies.
The honourable member for Hants West on your first supplementary.
Well, we're certainly pleased to hear that, Mr. Speaker. But, Mr. Speaker, my question again to the Minister of Agriculture. The Annapolis Valley has been subject to some harsh announcements, including the upcoming loss of 300 jobs at Larson's. What do you say to the people like Alan Burns losing his job in February, not being sure whether he will get another job like a delivery truck driver? How do you see this strategy helping the Annapolis Valley agricultural community?
The Honourable Minister of Agriculture.
Thank you, Mr. Speaker. I'm assuming Mr. Burns works with Larson's, and I thought those jobs were going to be maintained till April. Yeah, well, Mr. Speaker, none of us like to see job losses, but I guess the position that Maple Leaf found themselves in is related to national and international structures within the industry, and actually preliminary conversations have indicated that they have a hope that they may be able to do something else with that facility, and time will see whether or not that's possible. But I think this government is willing and pleased to work with the employees in whichever way is possible, and the company, to ensure jobs for the future in the Valley area.
The honourable member for Hants West on your final supplementary.
Thank you, Mr. Speaker, and I thank the minister for that answer. You hear quite frequently young farmers struggling with the cost of trying to get into this very important industry, Mr. Speaker. Will the strategy support young people getting into this important industry?
The honourable Minister of Agriculture.
Thank you, Mr. Speaker. Yes, the strategy does take a look at new entrants and with a plan to try to provide more support into the future for them to bring new people into the industry, not just young people.
The honourable member for Digby Annapolis.
Thank you, Mr. Speaker. Mr. Speaker, just lately, the NDP government released its second report on the state of Nova Scotia's coast. But, Mr. Speaker, on December the 9th, 2009, the Minister of Fisheries and Aquaculture announced that a coastal strategy will be developed for release in 2010. So my question to the Minister is, why is your coastal strategy not on time?
The honourable Minister of Fisheries and Aquaculture.
Thank you very much, Mr. Speaker, to the member opposite for the question. And I think there's a valuable lesson in here in my first response is that this particular government listens. We listen to Nova Scotians. There was extensive consultations on a better coastal strategy, something that's important to a number of Nova Scotians. There was 8 regional meetings across Nova Scotia. There was a phone survey. And this is a very complex issue, Mr. Speaker. We also have 15 departments and agencies that we consult on this complex issue. And there was a message that was loud and clear that was endorsed by the UNSM is that stakeholders, Nova Scotians wanted more time to consult on this, and that's exactly what we're doing. Thank you.
The honourable member for Digby Annapolis on your first supplementary.
Mr. Speaker, the Minister and the NDP government are delaying this report for another whole year. They are thumping their chest about doing more public consultations, but the consultations won't begin until the spring of 2011. So why is your government waiting so long to begin this second round of public consultations?
The honourable Minister of Fisheries and Aquaculture.
Thank you very much, Mr. Speaker, for this very important question. Again, Nova Scotia, we have over 11,000 kilometres of coastline. I can assure you that we have a number of stakeholders, but I just received a letter today, Mr. Speaker, and I'd like to table it and I'm just going to read a portion of it. And it's from the St. Margaret's Bay Stewardship Association. And I'll quote, "The seeds of the public involvement planted during this summer's public consultation can now sprout and grow. Nova Scotians have clearly voiced their awareness of the coastal's importance. And we are eager, through our colleagues in the Coastal Coalition, to expand this grassroots engagement in next year's dialogue as we move forward to discuss the draft strategy. Meanwhile, while you catch your breath, once again, congratulations to you and your team on a job well done. We'll roll up our sleeves, and we are there eager to help." Thank you very much, Mr. Speaker. I'll table that.
The honourable member for Digby Annapolis on your final supplementary.
Mr. Speaker, the report states that, and I quote, "Many current working waterfronts don't have the infrastructure needed to expand to other businesses such as aquaculture." Mr. Speaker, aquaculture is an important instrument of economic development for coastal communities. Communities are waiting for better regulations for this industry to ensure the stability of fish farming and the safety of our environment. So my final question to the Minister, will better regulations for aquaculture be held up by your government's slow-moving strategy on coastlines in Nova Scotia?
The honourable Minister of Fisheries and Aquaculture.
Thank you very much, Mr. Speaker. And I just want a clarification. There is a aquaculture strategy that is also moving forward, but talking about a coastal framework, this is a very complex issue, and I can assure you whether it's rising sea level, municipal land use zoning laws, or coastal developments, or public access to our coastlines. This minister, this government knows when we need to take the time and to consult Nova Scotians on such an important issue, and that's exactly what we're doing. Thank you.
The honourable member for Preston.
Mr. Speaker, it has come to my attention that veteran trailer inspectors are being pushed out of the business by this NDP government. The The rules have been changed that now people must take a $250 course to qualify, regardless of how many actual years of experience they may have, and they still must pay $250 to qualify. A $17.50 inspection, inspectors, especially ones who have been around for a long time, some over 20 years, will not see any profit for a very, very long time, if ever. Most businesses are simply not providing the service anymore. Mr. Speaker, the Minister of Service, Nova Scotia Municipal Affairs, would she confirm that these numbers are correct, that the inspectors only bring in $17.50 while the course is $250, and how her department arrived at a cost of $250?
The Honourable Minister of Service, Nova Scotia and Municipal Relations.
Thank you very much, and thank you for the question. And what I will do is I will find out about this situation. I can't answer that question at this time, but I take that under advisement, and I will have that information to you by tomorrow. Thank you.
The Honourable Member for Preston.
Mr. Speaker, this fee is a barrier to growing independent business. It simply makes no business sense for veteran inspectors to pay out $250 for what they've been doing for many years. There is no economic return for the cost. People simply cannot provide this service at a loss. And we see this effect, Mr. Speaker. The inspectors are leaving the business, making it difficult for residents to get the trailers inspected. This government is putting millions into a glossy pamphlet yesterday, but there's a situation here where the government could do something for jobs, and it wouldn't cost them by grandfathering the present inspectors into the system. Mr. Speaker, why has the minister not considered requiring new entries and those who receive complaints against them take the course, but allowing veteran inspectors to be grandfathered in so they can continue the business and service our communities?
The Honourable Minister of Service, Nova Scotia and Municipal Relations.
Thank you very much. The most important thing that we can do at Service Nova Scotia is make sure that we're following safe practices so that Nova Scotians are safe. As I said earlier, I'm not aware of the actual situation that the honourable member is bringing forward, but as I said, I will have that information to him tomorrow. But I just want to repeat that we are making sure that our roads are safe, and our practices are based around safety. So that would be part of my answer tomorrow, to find out exactly the situation that he refers to. Thank you.
The Honourable Member for Preston on your final supplementary.
Mr. Speaker, trailer inspections tend to happen in the spring. It's already hard to find an inspector, and if you call, you usually have to drive a long distance to get this job done, providing very poor service to the residents. But because of this fee, people have to leave the business, and it makes it even more difficult. These inspectors are entrepreneurs who have found a way to make a business and service their community at the same time. Mr. Speaker, inspectors have been contacting me and are concerned that it seems that the minister's lack of understanding of the business. My final question to the minister is, when you will be seriously addressing this issue and responding to the concerns of the inspectors and indeed to the residents of the province who are not being provided the same service they were a year ago?
The Honourable Minister of Service, Nova Scotia and Municipal Relations.
Thank you very much. This minister has an understanding of any issue that's brought forward to her. If industry has a problem and they want to come and speak with me about it, I am always available to meet with industry. This situation that has been brought forward today, I have not investigated. I will become very aware of it in the next few hours, and I said as I would report tomorrow. But I have not had any letters, and I have not had a meeting with the people in that industry, and I welcome to hear their particular situation so that we can move forward with this appropriately. Thank you.
The Honourable Member for Cape Breton North.
Yes, thank you very much, Mr. Speaker. And my question through you is to the Minister of Education. Mr. Speaker, It's getting close to 2 weeks now since the minister went down to Cape Breton for the matter of Holy Angels High School, and I just want on the record thank the minister for going down there, and she met with the students, she met with the board, and I do respect that. And we didn't respect some of the processes around it, but Mr. Speaker, I do acknowledge the minister for going down and taking the time and getting involved with the issue. But can the minister update the House on the status of the working committee she established, and specifically what options she has put on the table to keep Holy Angels where it is for the 2011-12 academic year?
The Honourable Minister of Education.
Thank you, Mr. Speaker. I can only repeat that the timeline for the staff committee made up of senior officials from both the board and the department is to look at options that allow the board and the province to live within its means and do what it can to save Holy Angels, especially in terms of those young women who are receiving an excellent education, continuing to be educated together. And we expect the report to be made to the board early in January. The report is to be finished by the end of December. We have full confidence. I understand that the participants on that committee have been in touch with one another, and meetings have been set up and scheduled. And I anticipate some very innovative, useful information coming out of that will help the board in their decision making. Thank you.
The Honourable Member for Cape Breton North on your first supplementary.
Yes, thank you very much, Mr. Speaker. And to the minister, as she knows, there are many pressing matters. She knows it's a priority within the community, and that people would have thought by now that in close to 2 weeks there would have been some things disclosed and brought forward to the board, because the minister knows the enrollment process for the next academic year will be underway very soon and will require a definite decision on Holy Angels sooner if grade 9 students are going to have Holy Angels as an option for next year. Will the minister ensure the girls in grade 9 in the Cape Breton Victoria District School Board that Holy Angels will be a choice for them in the next academic year?
The Honourable Minister of Education.
Thank you, Mr. Speaker. As I understand it, students from Holy Angels actually told me that the recruitment process for the upcoming year happens in the early spring. And so certainly the board has several months in which to prepare their recommendations and to fit it in with the other budget deliberations that they will be having over the next several months. So in terms of time pressures, there is time for grade 9 students in the junior highs to get the information that they will require to make course selection and to choose Holy Angels, which I'm assuming is going to be the positive outcome from this joint committee and the board's decision making. Thank you.
The Honourable Member for Cape Breton North on your final supplementary.
Yes, thank you very much, Mr. Speaker. And I do know and I do take the minister at her word that she will sincerely look for a solution for the next academic year. That's what the community is expecting, nothing less than that. But Mr. Speaker, with the boards struggling and boards across the province struggling with mitigation plans for a severe budget cut and having to review every line in the budget, and especially with young girls now looking and knowing that the fate of Holy Angels is in question, will the minister ensure Holy Angels will be a budget line item that will continue where it is for the 2011-2012 academic school year?
The Honourable Minister of Education.
Thank you, Mr. Speaker. You know, one thing became clear to me during all the meetings with the students, the parents, the staff, the principal, and the board, and that is the quality programming and the safe, nurturing atmosphere of Holy Angels is the educational experience that we want to offer every single teenager in this province. And I have no doubt that all the boards across this province share that objective with the provincial government, that we want to make sure that their secondary school experience is as positive as possible, and that we prepare them to be international graduates to go out into the workforce, hopefully in Nova Scotia, but that they will be well prepared for the 21st century. Thank you.
The honourable member for Halifax Clayton Park.
Mr. Speaker, thank you. Mr. Speaker, I have a question for the Minister of Health. And my question is about something that is very important to women and to families in Nova Scotia, and that is the subject of midwifery. 4 years ago, legislators in this very House finally passed an act, the Midwifery Act, to make it available to Nova Scotian women under the public health system. And when the act was passed, it took another 3 years to have regulations available. And unfortunately, today, women have less access in Nova Scotia to midwifery under the public system than they did in the past when they could pay for it. Mr. Speaker, the current system that's in place, the pilot project, allows only 3 DHAs in the whole province to offer midwifery, and there are only 7 midwives operating under that system in the entire province. Mr. Speaker, my question to the Minister of Health is, in view of this sad state of affairs, when is she going to ensure that women across Nova Scotia will have access to midwives through their DHA, regardless of where they live in the province?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. Mr. Speaker, I'm aware of the long struggle to get midwifery into the public health system. In fact, I would like to say that during my time here in the legislature, I've been very supportive and involved in supporting that effort to get midwifery into the public system. But, Mr. Speaker, it's not the case that there's less access than previously. We, in fact, have access in 3 DHAs in Nova Scotia, Gasha, the South Shore, and here in the capital through the IWK. So, Mr. Speaker, in fact, there is more access. Those pilot projects are being evaluated, Mr. Speaker, with a view to seeing what it is that we've learned from the pilot project.
Order. The time for oral question period has expired. I'll recognize the PC opposition or House Leader.
Thank you very much, Mr. Speaker. Can you call Bill 80?
Bill number 80. The Honourable Leader of the Progressive Conservative Party.
Thank you, Mr. Speaker. Mr. Speaker, I rise to speak in support of Bill 80 and to start the discussion about Bill 80. I note that we have many bills before the House this session, Mr. Speaker. Some are more important than others. There have been some dealing with issues like protecting our children from tanning beds. There have been others to discuss whether or not the motor vehicles branch should be able to send a letter after 4 demerit points or not. Those are clearly housekeeping bills, Mr. Speaker. They're not items of urgent importance to Nova Scotia, but those are bills that the government has decided to bring forward. I'm not here to debate the merits of them individually, other than to say, Mr. Speaker, that I believe with Bill 80, we have an opportunity to do something very important and very real with this session of the legislature by passing Bill 80 and getting on with the worthy objectives that that bill contains. As members know, Mr. Speaker, Bill 80 is about funding clinical trials for the MS treatment in order to give Nova Scotians the facts, in order to give the government the facts about the benefits of liberation therapy. This is a government, Mr. Speaker, after all, that claims it wants to make decisions on the basis of facts. I will say they're often selective on their use of facts, but they claim at least that they want to make decisions on the basis of fact. Then it begs the question, Mr. Speaker, why would we deny Nova Scotians the benefit of scientific trials? What are scientific trials anyway, other than the use of science to get at the facts about the benefits of this treatment? Mr. Speaker, the bill itself calls for a panel of experts to be formed That will lead to a request for proposals from the Nova Scotia Health Research Foundation. These are the places where facts get determined, where information is gathered in a scientific manner so that good decisions can be made. It begs the question, if we have a government that wants to make decisions on the basis of fact, why would we deny clinical trials a scientific method of ascertaining the facts in this case? Because, Mr. Speaker, the goals of the bill are very laudable, and they're very important, that we provide hope to those individuals and families that suffer from this disease, that we provide clarity as to the options available to them for treatment. And again, Mr. Speaker, all of this, the bill only asks that it be done on the basis of scientific trials and the gathering of facts, something the government has yet to see the benefit of. Mr. Speaker, we certainly recognize that there is a cost to gathering facts. We recognize that we live in an age of financial restraint. But even in an age of restraint, Mr. Speaker, it is important that this body set priorities for the province, that it indicate what it believes are important, even in a time of financial restraint. And I can tell you, Mr. Speaker, that Nova Scotians see this as a high priority. The Progressive Conservative Caucus sees this as a high priority. And even in a time of restraint, we need to have priorities. I can't help but note that in the province of New Brunswick, right next door, where they have a far more drastic fiscal position than our own province, that they have identified helping those who are suffering from MS, but who see some hope. They have found a way to identify some money for that purpose. That is an example, it's an even better example, of setting priorities in an age of fiscal restraint, and that is what they are doing in New Brunswick. But, Mr. Speaker, one might ask, why is this a high priority? Well, the answer is very simple. Nova Scotia has the highest incidence of MS in the country. There are very few families that are not affected by this disease in our province. The highest incidence in the country. A member brought a petition to this House with 10,000 signatures on it. That is a phenomenal amount of support for moving forward with a bill like Bill 80. Mr. Speaker, we rarely see petitions of that size on any subject. And yet for MS, we had a petition with 10,000 signatures on it. I can tell you personally, having just campaigned through Cumberland South, that this was raised an amazing number of times on the doorsteps of my riding. One would expect that citizens would bring up taxes and health care and education, but in equal measure, Mr. Speaker, citizens were bringing up providing treatment, funding scientific trials for liberation therapy. Living proof in that one riding, which is representative of every other riding, that there are a high number of Nova Scotians that want this body to move forward in the direction that Bill 80 proposes. After all, Mr. Speaker, this is a time when leadership is required. And if this is a province that leads the country in the incidence of the occurrence of MS, then surely we should be a province that leads the country in funding scientific trials and finding a cure or some treatment that alleviates the suffering of MS sufferers. That only makes sense. Not only that, Mr. Speaker, but there are other reasons why this bill should be a high priority for all members of this House. Nova Scotia has all it takes to lead the country and participate with other provinces in clinical trials. We have world-leading researchers. We have great surgeons who do similar procedures already. We have wonderful equipment and facilities at our disposal within blocks of this great building, Mr. Speaker, that could be put to this use to address this issue in a scientific manner, as the government claims to want to proceed, to the benefit of tens of thousands of Nova Scotia families and to the benefit of our country as we partner with other provinces who are coming to the conclusion that they too should do their part to advance the cause of science and to search for a cure, to search for a way to provide liberation therapy and other methods of mitigating the pain and suffering of this disease, Mr. Speaker. We have all that we need to have to make this happen right here in our province. At the moment, the one thing that we don't have is the will of the government, Mr. Speaker, but I'm hoping they'll see the wisdom of this bill and support it so that that last obstacle, their will to proceed, can be removed and good things can happen on this high priority item. Mr. Speaker, I could go on for a while, but if the government does need a business case, as it sometimes does, one can only point to the thousands of dollars that could be saved at the family level in Nova Scotia, as we no longer need someday, hopefully, to drive Nova Scotians to other parts of the planet in search of this procedure, to save the fundraisers that go on in communities big and small across our province, as whole communities come together, basically voting with their fundraising dollars in support of this treatment by gathering to help their fellow citizens go wherever they need to go. The Minister of Fisheries shaved his head. I'm an admirer of people who do that. Some of us don't need to actually shave, Mr. Speaker, but it's a good thing to do. But on top of the business case, Mr. Speaker, there is a very real human story that is being told across our province. Whether it's people that this House has been introduced to, like Yvonne Anderson in Truro, or Kevin Zachary, a world champion curler in Dartmouth, who was not able to pursue his sport but has received liberation therapy and is now back to competitive curling, or Keith Riley in Lewisburg, or Crystal Bruce in Yarmouth. I'm just naming a number of areas of the province where people have sought treatment and have seen their life improved. And in conclusion, Mr. Speaker, we all want to provide a better life for those people and to see that they can be full participants in the life and the workforce and the communities of this province, and that's what this bill is ultimately aimed at. Thank you very much.
I recognize the Minister of Health.
Thank you very much, Mr. Speaker. Mr. Speaker, I'm pleased to have an opportunity to rise and speak today on Bill 80, which is a bill, an act to require clinical trials with respect to MS liberation therapy and to allocate $5 million and to have a call for proposal for clinical trials in January. Mr. Speaker, I and members of my government have said that we will participate in clinical trials if and when the scientific evidence to do so is there. And Mr. Speaker, this is, without any question, it's been one of the most difficult issues that I've had to deal with as Minister of Health in my time as Minister of Health. We all know people in our community who are suffering with the effects of this disease, MS. And we know that there are many different kinds of MS. There are people who are at different stages. But the thing that we do know about people who have MS is that we don't have an effective treatment that halts or reverses this disease, and that there is a huge desire on the part of people who have the disease, their families, their friends, their communities, their physicians. All of us would want nothing better than to find an effective treatment. And when Dr. Zamboni postulated his hypotheses and published his paper, and the first reports came with that study, there was great excitement and enthusiasm and optimism. And Mr. Speaker, I've done a lot of reading on MS. I've done a lot of reading on the history of MS. I've spoke to practitioners who are specialists in this field, as well as had presentations from vascular surgeons and other people with experience and expertise around diagnosis, radiologists and what have you, to try to understand all of the dimensions of this issue that a layperson like myself, who is not a clinical physician, needs to understand. Because I take my responsibility as Minister of Health in terms of approving new treatments very, very seriously. Mr. Speaker, it is not the case that there is no research going on to substantiate a scientific basis for this new therapy. Mr. Speaker, in Canada today, we have a number of research projects underway. We have 4, in fact, in Canada, at 2 in Ontario, 1 in British Columbia, 1 in Alberta. And the funding of this research is about $2.4 million. There are additionally 3 research projects in the United States, and the 7 research projects that are underway to attempt to make the link between the blockages of veins and MS as postulated by Dr. Zamboni. They are not what we would call clinical trials. Clinical trials tend to be providing the treatment with a control group where you actually do some comparators. And I think one of the best explanations that I've seen on clinical trials was published in the Chronicle Herald on the 8th of September 2010. A piece written by Stan Kuchar, who would be well known to members of this assembly. Dr. Kuchar, although he is very open about not being a clinical practitioner with specialization in MS or vascular practice, but in psychiatry, nevertheless is a well-known health researcher in his field, very familiar with the scientific research process, and has laid out really how we get to clinical trials. And Dr. Kuchar, I just want to quote from his article here. He says, and I quote, "Before any treatment proceeds to a clinical trial, it must be based on a large body of evidence that has already evaluated potential benefits and risks. Clinical trials are the endpoint of a long, arduous, and complicated process of scientific evidence generation, not the beginning." Now, Mr. Speaker, I understand how difficult it is for people who want answers immediately, and it's for that reason that health ministers in this country asked that the research that I spoke to a little bit earlier is accelerated, and that we have that foundation-based research done as rapidly as possible, then that will then allow us to move forward with clinical trials. But Mr. Speaker, frankly, we are not there yet. We are still waiting for the results of the 7 funded research projects that I've referred to. And I'd just like to give members of the Assembly a bit more depth of understanding of the research that's currently underway. The research in the Hospital for Sick Children in Toronto is studying vein abnormalities in children and teenagers who have MS. and healthy controls of the same age. And they're seeking to determine whether the veins are abnormal at an early age among pediatric MS patients, and these findings will add to the depth of studies of CCSVI in adult MS patients. In Calgary, the research is focusing on a cross-section of people with MS compared to other neurological diseases and healthy volunteers. So the idea, as I understand it, is there's some question about whether blocked veins can be isolated to people with MS, or indeed is this a condition that is found more broadly in the population of people suffering from neurological diseases like Parkinson's, for example. And so these are very important questions to determine. Mr. Speaker, we also have a research project going on at the University of Ottawa that is exploring the best approach to diagnosing the vein abnormality or blockage. Is it MRI technology, or is it other technology, ultrasound, for example, which is in fact what Dr. Zamboni, as I understand it, used in his initial piece of research. And finally, we have research occurring across provinces at the University of Saskatchewan, as well as UBC and the Faculty of Medicine, looking at the prevalence of blocked veins in people with MS and comparatively to other people in the population more broadly. I think it's important to say to members of the chamber and beyond the chamber that it is unprecedented in this country that on the basis of one very small study without any control, that's Dr. Zamboni's original study, that the research community would have responded with a $2.4 million investment in these kinds of research studies. This has not ever occurred before, and it is only because the CIHI and the federal health minister and provincial ministers have willed it to be so.
I recognize the member for Halifax-Clayton Park.
Thank you very much, Mr. Speaker, and I'm very pleased to rise today and join the debate on Bill number 80, which is the Multiple Sclerosis Liberation Therapy Act. And at the same time, I would like to mention there are two bills before the House, the second one being the Multiple Sclerosis Patient Support Act. I believe it is 96, which is a Liberal bill. But I think it does show that a large part of those two bills are similar. And the additional part that is in Bill 96 is that not only does it call for clinical trials, that Nova Scotia should play a role in clinical trials, but it also calls for the following sort of monitoring and identification of those Nova Scotians who have raised the money or spent their own money and gone to other jurisdictions around the world to receive this therapy. You know, we know that there are many people who've done it. In fact, the figure we were given was around 125 Nova Scotians. And remember that this is a therapy. Well, I don't know what it is, and the minister doesn't know either. She's not sure it's 125, Mr. Speaker, but I don't know either, and none of us know. But I know that in my community there are fundraisers going on, that I attended a dinner not very long ago, in fact, for a woman who is planning to go to Costa Rica, and there are others. I have talked to people, you know, in other communities and so on. I know many people are anxious to go as well. So we know the numbers rising, and the fact is that I think it's irresponsible not to know where the Nova Scotians are that have had this treatment and what are their outcomes when they come back, just so that we can learn something more as well. There's another level of study and understanding, and I think it would also help us to understand the complications that may be there, or the benefit, the long-term benefits, because many people are returning and saying that they are definitely feeling better. Their family members are confirming that as well, and we need to understand it. And I hear the minister about being responsible and being careful and following the proper scientific procedure, I guess, to look at clinical trials. But we have Nova Scotians whose health is declining, sometimes very precipitously, sometimes quickly. As the minister said, some people can have MS for years and continue to function, and others will lose their capacity very quickly and find themselves in a wheelchair or worse. And Mr. Speaker, there's this idea, I think even some doctors feel that it's not such a dreadful prognosis to have MS, but I had a mother in my office very recently who I know in the community in Clayton Park, whose daughter is 23, she's the same age as my daughter, and she has MS. And that girl said when she was in to see the doctor first, they said, "Oh, I don't know what you're so upset about. It's MS. What are you so upset about? It doesn't kill you." And she said, "Yes, it does." Her uncle had died from MS. He had died at the age of 50. It can be terminal. It is serious. And people are desperate, and they're looking for, how they can not only have a better quality of life, but hopefully, continue to live a long life. And I just mention that because people are so anxious to know more. The only way they're going to get the evidence is to speed up the clinical trials. And I know the minister mentioned $2.4 million, and I'm very glad that there's been enough pressure that money has been dedicated to some studies. But we all know in the realm of medical studies, $2.4 million is a baby step. It's a first step. It's very small. And people are aware of that in order to get a reliable clinical study, you need to have two groups. You need to have one group that is getting the placebo, one that gets a different treatment, and so on. And it takes time. And so getting it going is what's so important. Mr. Speaker, one of the things that concerns me is that when you give money to the MS Society, you can tick off a box that says you'd like it to go to this new CCSVI, I think is the initials, which is the liberation therapy. And I think a lot of people, as they're supporting the MS Society, want to do that. And I'm very concerned, Mr. Speaker, that as people tick that off and the amount of money coming in exceeds the commitment that the MS Society has made to liberation therapy or any of these trials on the blockages of the veins, that money will not go or be saved for CCFVI research, but will be redirected to the traditional research in drugs and therapies that are more traditional. And I think the government should be aware of that and should make sure that that's not happening. Because if the trials are coming slower than the money is coming, the money should be held back and used only for that MS liberation therapy studies. Because that, I think, is really misrepresenting the intent when you allow people to tick off that box and say, that's the kind of funding I want to donate my money to. And so that is something that I think is critical if that's being done. So I would like the minister to look at that as well. But Mr. Speaker, there are too many different kinds of procedures actually being done around the world that are being done under the umbrella of saying that they're following Dr. Zamboni's procedures. And I had the opportunity in the summer to spend a couple of hours actually with Dr. Sandy MacDonald, who is a vascular surgeon from Barrie, Ontario, who's actually studied under Dr. Zamboni in Italy. And he's been outspoken. I believe he was featured in the original shows that we saw on Fifth Estate, I think it was, that first had two shows that discussed this procedure. Am I right? W5? W5, sorry, W5. I knew it was Canadian, but anyway, in that instance, he had actually been a proponent of it and still is a proponent, but he said in the absence of more trials and some standardization, what's happening is the procedure is not standardized and people are getting different care depending on where they go. And the government has a role to play here to try and ensure that what is the best practices and what is known about this procedure is followed. And right now we can't do that with people going elsewhere. We need to get the trials going here in Canada. And here in Canada is a place where we have a world-class system. Here in Nova Scotia we have terrific researchers, a researcher group at Dalhousie and at our Capital Health District who have many people who would be willing to be in that trial, who would volunteer to be part of a clinical trial on MS. As was mentioned, we are the province with the highest per capita incidence of MS. We don't know why, but we know that we have more people in our little population per 100 or per 1,000 that have MS. And that makes it a more compelling reason why we should be part of those trials, even if it's in a small way, even if it's in conjunction with some neighboring provinces or contributing to a bigger study. But you know, I was surprised and interested to see that New Brunswick today had begun to put something behind this. But I think that the health ministers have talked about it when they've gathered this year. The Minister of Health has assured me they did. There is pressure from our population, and it is urgent. This is not a disease that I think, you know, we can assume people can continue to just live with maybe limited or declining capabilities. It can be terminal, and it also takes away so much of their energy and enjoyment of life. And there's a young mother in my community who's raising 2 young girls, has MS, and really feels she can't enjoy so much of their lives because she doesn't have the energy. And she said to me the other day, I can get up and get them out to school, and then I have to go back to bed. And I know that the member from Cape Breton West will understand what that means, because his wife has said similar things about her day. It's very debilitating. It takes away so much enjoyment of life. Now, when we're talking about this MS liberation treatment, I think it's important to know that people who are studying it and reading it and about it and looking to go away are not saying it's a cure. And none of us here in the House should say it's a cure. It appears that it's a treatment that could make their condition better and give them a higher quality of life. And there are examples of people coming back and returning to work, people who've been on long-term disability being able to go back and resume their work. How much does that cost the province of Nova Scotia? If we can take these young people, and remember who gets MS, it exhibits itself generally in that sort of 20 and 30-year-old age group. It's something that hits people in their prime. And I think there's a great deal of benefit to be able to say that there could be a treatment there, and we should be exploring it, because that can give back the quality of life to those people. And Mr. Speaker, I think I have only 1 minute left. Okay. I'd certainly like to say that I believe Nova Scotia should be part of these clinical trials, that we have an obligation to the people who, you know, really feel so strongly that this is something that they want to access, that they are actually taking risks and going overseas to different countries. And even today in the Globe and Mail, there was an article where Dr. Zamboni was saying governments have to step up, because this almost industry that has grown up in different countries so quickly, grown up in 1 year around the world, is really out of his control in terms of what treatments and what sort of standardized treatment they're going to get there. So government needs to, I think, move more quickly, and the trials need to be more aggressively begun, because people are not waiting, and we need to be able to follow their results and see how they're doing. And Nova Scotia really owes it to the people that are suffering with MS and their families to do something about it now. Thank you.
I recognize the member for Cape Breton West.
Thank you, Mr. Speaker. First, I'd like to thank my colleagues for their thoughts on Bill number 80 and the MS. I rise today to speak in favor of Bill 80, an act for clinical trials on the liberation therapy for multiple sclerosis. You know, Mr. Speaker, I know very well that we are still in difficult economic times, and that we must be very careful stewards of taxpayers' dollars. Because of that, my caucus colleagues and I thought very carefully about the general situation before deciding to move forward with this legislation. We concluded that first and foremost, government has a responsibility and a duty to perform essential services, including health care, to Nova Scotians in the most effective way possible. It is the duty of government to ensure our citizens have access to all drugs and treatments they need, including those that can save, prolong, or significantly improve the lives of our people. I am proud that has been the progressive Conservative policy since we introduced Medicare to Nova Scotia more than 40 years ago. I was proud of our former government when we decided to cover the cost of the cancer drug Avastin, and I was pleased to see that the current government recently announced the funding for the eye drug Lucentis. And it is in part, and it is in that spirit that I introduced Bill 80 earlier this month. But, Mr. Speaker, there's another feature of Bill 80 that I would like to talk about. Providing liberation treatment in Nova Scotia for our MS patients will actually help save money. The liberation treatment for MS patients can probably be implemented as a day surgery with a cost of probably less than $5,000. There are some MS medications being used in this province today, Mr. Speaker, that cost $40,000 a year. So it seems to us, Mr. Speaker, that $5 million for clinical trials on liberation therapy makes common sense from all perspectives, both compassionate and economic. And it's the same number, Mr. Speaker, that the province of Saskatchewan is using. In this regard, Mr. Speaker, it's very important to note that Dr. Zamboni, who pioneered the liberation treatment, in an interview that was in today's Globe and Mail from the University of Fiera in Italy, where he works and teaches, said, and I quote, "Governments must take responsibility to prevent unsafe treatments of applications of liberation therapy by offering a safe procedure at home. The only right defense against a faulty treatment is a clear action from government," end of quote. Now, Dr. Zamboni also went on to question why a country like Canada, with a very good public health system, refuses to support a treatment study on 500 people. His point, Mr. Speaker, is well taken, and I find it difficult to understand or accept why governments in Canada cannot seem to understand the need to move forward on this potentially life-saving medical issue in a much faster fashion. Mr. Speaker, the Minister of Health here in Nova Scotia is developing a new drug strategy. Common sense tells me that this liberation treatment for MS could be part of that strategy. Mr. Speaker, MS is a terrible disease. Often MS patients lose their ability to swallow or even lose their eyesight. Men and women suffering from it want to be helped. They want relief from this debilitating symptoms, and they want hope. Liberation treatment, Mr. Speaker, represents that help and that hope. Therefore, Mr. Speaker, I believe all members of this House should join our caucus in support of this bill, and will make life bearable for many, many of our fellow Nova Scotians, and also help save some tax dollars. The $5 million that the bill will spend is one of the best investments in building a better, healthier Nova Scotia that can possibly be made. Mr. Speaker, as many in this House know, in late August, I had an opportunity to meet with the Federal Minister of Health. She told me at that time there were federal funds available for MS research. She also said that at that time, no group or government in Nova Scotia had sought any of that funding. I mention that today, Mr. Speaker, because it is possible that some of that federal funding is still available to help with the cost of clinical trials of liberation therapy, and we should go and look for that. It's never easy, Mr. Speaker, to move into new territory in the world of healthcare, delivery, or in any other area of public policy. But our society has moved forward, and our province and country have become much better places in which to live and work because individuals, entrepreneurs, scientists, and governments have had the courage to blaze new trails as they saw the positive potential of promising new innovations. Dr. Zamboni's liberation therapy is such an innovation. It's just a year ago that Dr. Zamboni's procedure came to light, and MS sufferers had a new reason for hope. Mr. Speaker, people who deal with MS in their daily lives believe strongly that this treatment is the biggest breakthrough yet in helping to battle this disease. It offers hope, it creates focus, and yes, it improves their lives. So it is time for us as elected folks to step up to the plate and show we care, show that we are real listeners and leaders of our province. There are some critics or skeptics around, Mr. Speaker, but I believe they are wrong. I've seen proof in my own family. But at any rate, if we get these clinical trials done, Mr. Speaker, we will know what the real answers are. I know that at least one doctor here in Nova Scotia has sent an associate to Barrie, Ontario, to learn to do the Doppler process for finding blockages that Dr. Zamboni believes to be associated with MS. A major report several years ago indicated that one of the criteria for MS diagnosis was related to blood flow. Blockages of blood have a critical effect on MS patients. Now, some folks say that not all MS patients have blockages. And Mr. Speaker, my wife Shirley underwent the Doppler test and it showed no blockages. As a matter of fact, when she had the procedure done, on the left side, she was 95% blocked, and on the right side, her vein was bent like that, and they were able to straighten it out. But and I've heard the same story from other people who have gone for the treatment, and when they had the Doppler, there was no indication. Mr. Speaker, it is incumbent upon us to provide the opportunity and hope that this offers. The current practice is saying to MS sufferers who reach a certain stage, saying, sorry folks, there's nothing else that can be done, it's unacceptable. Mr. Speaker, as I have said before, in Atlantic Canada, we have a high rate of MS. I believe from personal experience that it does work. Shirley is a living example of the positive effect of the liberation therapy. I see good things all the time when I see Shirley go about her day, fully and confidently and in control of her life, something that wasn't there before the treatment. Now, Mr. Speaker, we know it's not covered here in Nova Scotia and that's part of the reason why we're here. We also know that the Newfoundland, Saskatchewan, and even today, the province of New Brunswick has put forward some ideas as to how they can help with this. And I'm pleased to say that when asked the question here in the House, the minister who had talked about people getting treatment when they came back, if they need a follow-up, she was the first one to say that that would happen here in Nova Scotia, and I thank her for that. However, I must say that her comment about medical tourism was not needed or appreciated. The Honourable Premier and the ministers across the way, they say they're not doctors, and Mr. Speaker, we're not either. And there's so much more that I would like to say. But Mr. Speaker, I want to leave this House with this thought. We have many Nova Scotians who have traveled and had this procedure. We should be working with them to find out how it's affecting them, what's the better way. The quality of life that people can get by having a treatment done is important. My colleague from Halifax, Clayton Park, introduced a bill as well. And I want to say thank you to her for that, Bill number 96. But Mr. Speaker, I want to make this one thing perfectly clear. It matters not to me whether Bill 80 or Bill 96 or which bill it is that might get passed, if it's a bill that's brought forward by the minister. But what is important, what matters, and what we as members of this House is that we do the right thing for Nova Scotians with MS, that we allow them to be treated at home, maintain their dignity, and have a quality of life that is deserved by all Nova Scotians. Thank you, Mr. Speaker.
Recognize Leader in the House for third party.
Thank you very much, Mr. Speaker. Will you call Bill number 44?
I recognize the member for Colchester North.
Thank you, Mr. Speaker. And I rise in my place to speak to Bill number 44, Maintenance and Custody Act. And I want to thank you, Mr. Speaker, for the opportunity to do that. It is with a great deal of pride that I stand here today to speak in favor of this legislation. Pride because it is an example of the Progressive Conservatives having listened to Nova Scotians, and we are taking action on the things that they care about. And I know, Mr. Speaker, that members of the opposition party have also spoken favorably about amendments to the Maintenance and Custody Act. People like those who are involved with the Grandparents' Right for Nova Scotia an organization that has been working to ensure grandparents are able to maintain ties with the grandchildren they love. And Mr. Speaker, I've had an opportunity to speak with the member from Cumberland North, and some of those grandparents in that association are constituents of the member of Cumberland North. Mr. Speaker, it should be noted that this is a vital piece of legislation, and it's important to many Nova Scotians because it will make a real difference in their lives. It's important to grandparents and children who have seen their families separated by family breakup, and sometimes in very difficult circumstances. The Law Reform Commission of Nova Scotia recommended these changes in its April 2007 report, and I will table that report. The report noted that relatively few cases will actually end up in family courts as a result of what's proposed in this legislation. So the impact on an already busy court system will be minimal. The report states, and I quote, "The cases that do come before the courts, therefore, represent a very small percentage of the overall number of potential family law disputes," end of quote. This means that while the administrative impact will be minimal, the benefits to families will be great. As a private member's bill, this was brought to the floor of the legislature on October 14th of 2009, and it was not called for second reading. It was reintroduced as Bill number 44, the Maintenance and Custody Act amended, in April of 2010, and it was not called for second reading. So it is being put on the floor of this legislature today as our opposition day, because it is a bill that is worth discussing, and it deserves the discussion on this floor. I want to help those members of the House who may not be familiar with the bill to understand exactly what the amendments will do. And although the amendments seem minimal, the impact is significant. There are three main amendments. The first one is to define grandparent. And grandparent will be defined as the parent of a child. The second amendment talks about adding grandparent to subsection 18.2. And in subsection 18.2, it is talking about custody. And everywhere that parent is considered for custody, this amendment would also add grandparent. And thirdly, it talks about and it refers to the principles that would be adhered to when the courts respond to an application by grandparent for custody. And it speaks to the principle that a child should have as much contact with each parent or grandparent as is consistent with the welfare of the child. And those are important words. Secondly, the importance of maintaining emotional ties with the child and the child's parents and grandparents. And the third consideration, the willingness of each applicant for custody to facilitate the child's contact with each parent and grandparent. Those are the amendments that will allow grandparents to apply for access to their grandchildren, and they apply through the courts, and it is the courts that will determine whether that access is granted or not. Bill 44 was introduced and supported by our caucus because we want every child in Nova Scotia to have as much contact with their parent and their grandparent as is consistent with the welfare of the child. In April 2007 report that I tabled, it states, in order to help guide judges, parents, grandparents, and other interested persons, the Maintenance and Custody Act should be amended to provide, and I quote, a best interest of the child list of factors to consider, similar to provisions in the Child and Family Services Act. And that's exactly what happens with Bill 44. The Commission also recommended that Section 18.2 of the Maintenance and Custody Act be amended to provide an application process that may be made by a parent or grandparent, and Bill 44 speaks to that. It's also noted in the Law Reform Commission that grandparents have no automatic right for access to their grandchildren, and legislation in all Canadian jurisdictions now makes that possible for them to apply. This amendment will make it possible for grandparents in Nova Scotia to apply for access to their grandchildren. What the amendments to this legislation propose is not unconditional access, and I want to make that very clear. It is not unconditional access, and unfortunately, Mr. Speaker, there may be situations where access should be denied. And these amendments protect the child from that unconditional access. The legislation calls for access to be considered and could be granted through a custody application in the courts and a ruling by the courts. The legislation is committed to raising public awareness about the important issue of grandparents' rights and to remind us how important the relationship between children and their grandparents is. And it should be noted, Mr. Speaker, that many Nova Scotians, including myself, have a warm and close relationship with my grandchild. And that is something that every grandparent should have access to, and a process so that access can happen. It happens, Mr. Speaker, we pride ourselves in Nova Scotia in being close-knit families. And this is one of the ways, Mr. Speaker, that we can maintain the closeness of a child with their parent and their grandparent. So in closing, Mr. Speaker, I want to remind all members of the basis for this bill. Decisions made are in the best interest of the child. Decisions made are with the safety and well-being of the child as a top priority. Decisions are determined by the courts, and decisions provide a vehicle for grandparents to be considered in the custody decision of the courts. So, Mr. Speaker, I'm asking that all members of this House understand the amendments and support Bill 44 so that Nova Scotia grandparents can grow old enjoying their grandchildren. Thank you very much.
Thank you. The chair now recognizes the honourable member for Antigonish.
Thank you, Mr. Speaker. Mr. Speaker, I'm pleased to rise today to speak on this private member's bill number 44 to amend the maintenance and custody so as to provide grandparents with an automatic right to apply for access to their grandchildren. Mr. Speaker, this government is committed to making life better for families in all regions across our province. And we all know that children are the most important members of families. This government understands that, in most circumstances, grandparents want to have a relationship with their grandchildren. Healthy relationships between children and their extended family is something that this government values, and in many cases, it is a positive experience for the child. But in order to properly facilitate those relationships when access is concerned, we must remain respectful of the child's rights and best interests. Under the Maintenance and Custody Act, Mr. Speaker, all grandparents have a right to apply for access to their grandchild. However, they are not automatically granted access. Mr. Speaker, under the current legislation, grandparents who wish to obtain access to the children must participate in what is called the best interests of the child test. This means that each case is to be assessed on the basis of its own merits, as determined by careful consideration of the particular facts presented by that case. In some cases, the test may lead to a grandparent being granted access to their grandchild, and in some cases, it may not. Mr. Speaker, I appreciate that when access is not granted, it would be very emotional and difficult for the grandparent involved. However, Mr. Speaker, like all decisions relating to children, we must not lose sight of what is important, and that is the child's best interests and rights. Mr. Speaker, when it comes to legislative authority, we must ensure that appropriate processes are in place to ensure that legislation focuses on the child's best interests. Mr. Speaker, the Maintenance and Custody Act in its current form accomplishes this. That is why, Mr. Speaker, this government has some concerns with Bill 44. To begin, Mr. Speaker, in these types of cases, there is no way to distinguish between the rights of a grandparent and other close family members, like an aunt or uncle, when determining who is to have access to a child. Mr. Speaker, in this province, parents have a right to decide who will have access to their child. Therefore, parental decisions regarding whom their children will associate with should be left to the discretion of the parent. The court only interferes in the most compelling circumstances and when that is consistent with the child's best interests. Mr. Speaker, a review of the case law indicates that in many cases where parents have denied access to a grandparent, the courts have agreed with that decision. Also, Mr. Speaker, providing grandparents with automatic access to their grandchild when the parent objects could potentially cause a parent to become defensive and could create conflict in the family and for the child. Currently, the legislation works to protect the child from those type of conflicts. Mr. Speaker, at the risk of sounding repetitive, we must put the rights and interests of the child first, and this government has confidence that the Act, in its current form, provides a balanced approach. Because of the concerns I just described and our confidence in the current legislation, unfortunately, Mr. Speaker, this government is unable to support this private member's bill. Mr. Speaker, my own experience with these matters is that when there is a dispute, the grandparent is entitled to apply to the court to make an application for access to the grandchild. The court then becomes involved and makes a determination of whether that access is in the child's best interests. It's a two-stage process. Leave must be granted. At that stage, the court can look at the case in particular and decide at that stage whether or not it's in that child's best interest to allow the application to go forward. So what this Act is attempting to accomplish, we suggest is already available in the current legislation, and therefore it's unnecessary for us to amend or to change the Act as it exists. When it is the child's, the best interest of the child that has to be considered, the grandparents' interests have to come second. If a court determines that the best interests of the child are not to allow access, then that determination has to be respected. And as I said, under the current legislation, we're able to accomplish that now. So with those comments, I want to just reiterate that we have to assure ourselves that when we're passing legislation, it is what is aimed at trying to accomplish. We have in the existing legislation ample means of protecting the children's rights and ample means of allowing grandparents in appropriate circumstances to have access. The process is there. It is cumbersome sometimes to have to go through these processes, but again, we have to keep in mind always that what we're trying to achieve here in these very difficult situations where families are in dispute about who should have access, it's not the grandparents' rights, it's not the parents' rights, it's the child's rights that have to be maintained and upheld. And in these kinds of cases, yes, it's very difficult. It's an emotional situation. It's hard for grandparents to... 4 minutes. Sorry. It's hard for grandparents to have to perhaps not have access to their children, but it's not a determination that's made at the by a parent who has a grudge against a grandparent or something like that. The grandparents have the means of coming forward and saying to a judge, an independent person, somebody who is trained particularly to deal with these matters, and say, and we have these courts across the province, both Family Court and the Family Division of the Supreme Court of Nova Scotia, that allows grandparents to come forward in an appropriate situation to make this application. So it's not the will only of a disgruntled or warring family faction here. It is a determination made by a court based on solid evidence. So when we look at this bill and we say, well, why are we doing this? Why is this act coming forward? I suggest that the legislation that's in place now clearly enables a grandparent who seeks redress or needs redress to have that. Again, we have to weigh what is best here for the child. The child is the focus of this access application. The child is the one whose interest must be put forward first. Yes, grandparents do have and should have rights to come forward to get access to their children when that is being denied, and being denied willfully or arbitrarily by a parent, perhaps. But that can be addressed and is often addressed and has been addressed under the present legislation for quite some time. So it's not as if this is going to make a big change, this act. It's not as if it's something that is going to be coming forward that's going to solve a problem that doesn't have a solution to it already. You can't legislate, I guess, peace between warring factions in a family, but what you can do is make sure that the child, who sometimes is the object being fought over in these kinds of family disputes, is being protected. And that is happening now. I don't see that there's anything in this legislation that needs to go forward that's going to improve the situation. We have a system in place, an orderly system where, and the speaker before me indicated that there is a process that can, through the new legislation, can get access to the court. Well, that is in existence today. It's not something that's foreign to the courts. The courts have been dealing with these situations appropriately for quite some time now. So again, if we try to fix something, to make something better, it seems to me that there has to be something here that would indicate that there is a need. And I don't see in this legislation anything new being brought forward that doesn't already exist in the current act.
Tell them how you would feel. Tell them how you would feel.
Thank you. That doesn't already exist in the current act. I have had 35 years of experience working in the family courts, and I've seen many of these similar type of cases in the past, and it is a painful situation for all involved. But again, all we can do and hope to do is to try to protect the child, and that's what the existing legislation can do. So, with those few comments, I would indicate that we're not going to be able to support this bill. Thank you.
Thank you. Chair now recognizes the honourable member for Kings West.
Thank you very much, Mr. Speaker, and pleased today to rise and speak to Bill 44 and to offer our caucus position here. A very basic position, of course, is very, very strongly in support of grandparents' rights in Nova Scotia. It's interesting to note that the Grandparents Association came before the Standing Committee of Community Services on Thursday, March the 31st, 2005. And at that time, the member for Dartmouth South Portland Valley was the chair of the committee, and looking at some of the comments made at the committee level, I would say that perhaps the NDP position was more empathetic at that particular time than perhaps the current dissertation that we had from the member for Antigonish. So we do see somewhat of a perhaps change going on there. At that time, they were asking for a few changes in the legislation because they saw what had been done in British Columbia, Quebec, Alberta, New Brunswick, Yukon, and I think on further inquiry today and a little bit of research, just about every province in Canada in their legislation is using the word grandparent. And whereas in Nova Scotia we don't have that direct reference to grandparent, so that's an area that I think we support the use of the word grandparent, and any changes that would come about in legislation must be in the best interest of the child, and a continued relationship based on concrete evidence, and that's of course where the courts come into play in this regard, and we know as the member who put the bill forward from Colchester North, she was very explicit in saying that indeed it would be the court that would be making decisions on access for grandchildren. So I think we've established the importance of that process, which brings to light as well some discussion, perhaps more behind the scenes in our province, about the very future of family court, and I think family court provides grandparents with one of the best opportunities to have access and to have their rights, and again based on concrete evidence, to allow them to have the right access and proper relationship cultivated through, I believe, family court. I think there's a greater sensitivity to families, and I think greater discernment on the dynamics of the family as to whether or not, and again, as the member for Colchester North pointed out, it's not in the best interest in all cases that a grandparent have access, let alone custody of a child. There are many in this House who know from their life experience, I know as an educator, family separation is alarming to children, and the kind of impact that it makes on their lives when it does happen. Also, the support that they need, very often it is the grandparents, but we know during that process that grandparents can be left out of the picture because they are caught up in many times in a divorce and a separation, and there is anger towards grandparents, and very often this is the essence of why sometimes grandparents, in fact, are shut out of the lives of children. In my view, I've seen grandparents, take over very strong roles as parents and provide the kind of strong relationship, the kind of guidance, the kind of stability that is lost when divorce, separation, or death. We all know that can be a factor as well that sometimes needs to be taken into account. So grandparents need the kind of support through legislation that in fact can give them assurance when the evidence supports what they would need to do. One of the documents tabled today by the member for Colchester North, of course, was the Grandparent-Grandchild Access final report, the Law Reform Commission of Nova Scotia. It's already been tabled. And the commission at that time determined that there was an opportunity for reform in the area of grandparents and grandchild access. Now, we know that was done in 2007. Grandparents came before a standing committee in 2005, and yet we know that there are a lot of gaps in terms of the development of grandparents' rights in our province. And that's you know, why this bill has come forward. In fact, at committee, grandparents said judges, lawyers, and others need education on knowing the importance of having grandparents play a significant role when and where possible in the lives of grandchildren. And this is why I brought up the matter of the importance of family court. And there seem to have been cases, and again, those who appeared before our committee actually noted some cases where there seemed to be a lack of sensitivity that grandparents could in fact carry out a significant role in the lives of their grandchildren. We know that child neglect and abuse takes place, and this is not something particular to Nova Scotia. We know that it does occur. One of the areas that you know, I'm familiar with grandparents who often came into school because they knew a grandchild had left home without any lunch that day. And so just on, you know, basic welfare issues, grandparents, you know, have a place, have an important role to play in the lives of their grandchildren. So one of the things that, you know, the commission talked about and was one of their final recommendations for reform was in order to help judges, their recommendation said in order to help judges, parents, grandparents, and other interested persons, the Maintenance and Custody Act be amended to provide a best interest of the child list of factors to consider, similar to the provisions in the Children and Family Services Act. So this is an area where I think all of us as legislators and all those who are wanting to promote, cultivate grandparents' rights in this province, setting down some of the factors to consider would in fact provide the courts with greater guidance and a greater level of comfort for grandparents. So, Mr. Speaker, I know my time is running short, or perhaps just about out, and so with that, I will take my place.
Thank you very much. Chair recognizes the honourable member for Argyle.
Thank you very much, Mr. Speaker. It's my pleasure to stand today and speak for a few moments on Bill number 44. First of all, I want to thank the member for Colchester North for bringing this forward. It is a very important bill, and I know that the member for Antigonish did stand in his place and speak against the bill, not understanding the full implications of grandparents or children not being able to see their grandparents. Mr. Speaker, the primary concern of our caucus is the safety and best interest of children in our province. Mr. Speaker, where appropriate, we believe having close and warm relationships with their grandparents is the best interest of children. And presently in Nova Scotia, grandparents have neither the presumptive right of access to their grandchildren, nor the right to apply to the court for access. Mr. Speaker, this legislation will give grandparents the opportunity to apply to the courts for access to their grandchildren. Now, Mr. Speaker, I know many people in here, we can talk fondly of our grandparents, things we were able to do. You know, some of us have grandparents that are still alive, and we do get to spend time with them. Mr. Speaker, I spoke many times before of my grandmother who is 97 years old. I still have a great opportunity to go down and tell stories with her, and she's always got some great stories, and she always comes out with a new song that none of us had ever heard before that she used to sing as a child. Now, Mr. Speaker, sure, I'm 41 years old, and I can make my own choice to go and hang out with my grandmother or see her at different functions, what they may be. But Mr. Speaker, if I didn't have access to my grandmother, I don't know where I would be in this world. You know, I have a very loving set of parents, but should they have a divorce along the way, which seems to be the trend, I might not have known my grandmother, or would have had the opportunity to know my Acadian roots and to understand the importance of being bilingual. It was many a time that my grandmother would tell the other children that we were playing with, talk to Chris in French, he can. And you know what? I thank her for that. But you know what? I might not have had that opportunity. Mr. Speaker, we always have the quintessential story of fishing with your grandfather. And I remember my time fishing on the Medway and catching my first fish with my grandfather. Now, I thought it was the biggest darn fish going. And I remember eating it and thinking that was a pretty darn good piece of pink fish. But you know what? I caught a Gaspro, and he gave me a piece of the salmon he caught the day before. Mr. Speaker, I remember those things. They were very, very important to me. Mr. Speaker, I don't know where this opposition part or this government party is today. I don't know where the member for Cumberland North is today, because I know the member for Cumberland North had been approached by the association, the Grandparents Association, led by one of his constituents, Pauline Glenn. And I know by putting the lawyer up and speak to it, someone who has 35 years experience to speak to it is important. But I wonder where and what the thoughts are for the member for Cumberland North, because I think he said something different to those folks. Mr. Speaker, I want to refer to a letter dated August 25th, 2008. It was written to Pauline Glenn of Wallace, Cumberland County. And it goes like this. I have received your letter and a copy of Private Members Bill 33, which was presented in the Ontario Legislature on the issue of grandparents' rights. I applaud your association for the work it is doing on behalf of grandparents as it relates to having access to grandchildren. Your suggestion that legislation similar to Bill 33 be introduced during the next legislative sitting will be taken into consideration with caucus members and our research staff. I thank you for writing, and my staff may be in touch with you before the legislature resumes in the fall. Sincerely, Darrell Dexter, NDP Leader of the Opposition. I want to table that. Mr. Speaker, I also want to table a letter, and maybe the governing party can have a look at this and maybe put some more thought into whether supporting or not supporting Bill number 44, or heck. I know, Mr. Speaker, when you were speaking to your bill just a few moments ago, you sort of said, you know, it really doesn't matter if this bill goes forward or the Liberal bill goes forward or if the government introduces a bill and that one goes forward. Because in the end, we want children to have access to their grandparents. Because it's not, you know, even though we say it's grandparents' rights, and I'll table that letter. And by the way, that letter is Grandparents' Right for Nova Scotia Association, and it went to the Justice Minister, and I think you'll find it interesting to see what he had to say, or what she had to say to him. Mr. Speaker, I can tell you that divorce is going to happen. And I know the member for Antigonish has seen many divorces. And he talked about the warring factions. You know, not all divorces end in an amicable conclusion. And who's left in the middle of that? Children are left in the middle of that because the parents, they're caught up in whatever they're caught up in. And the grandparents are trying their best not to take sides because they understand what's important in this too, which is the children. So, Mr. Speaker, you know, never mind the semantics of this, never mind whose good idea this is, because God, you know, if we have good ideas, well then let's bring them forward and let's talk about them and do things that are right. Now, Mr. Speaker, in a perfect world, there would be no need for this legislation. But like I said, unfortunately, family breakdown and divorce are a fact of life. So I can say that our caucus sees this legislation as something that will cost government very little and at the same time provide a very large benefit for many, many Nova Scotians. As my colleague for Cumberland North said, this legislation is recommended and supported by the Law Reform Commission of Nova Scotia. And as she said, members of the Law Reform Commission believe the legislation will add little burden to the courts and pay large dividends to families. So it's not just our caucus that are saying that. It's not just Pauline Glenn and her association saying that, but it's the Law Reform Commission of Nova Scotia. And I know Jerry Pye had some. I know the member for Kings West was speaking about that as well. So all around us we have the best intention for children, yet we're letting this opportunity pass us by so that Pauline Glenn and her association are going to have to work even harder to convince that lot that this is something that needs supporting. Mr. Speaker, I can say that the member from, well, I believe I heard some noise over there, and he was saying, well, why didn't you do it? Well, Mr. Speaker, I can say quickly to that member, and he knows the minority situation that we're in, that many of those bills were brought to their attention. They knew about them, and they didn't support them, so they weren't brought forward in this House. So even though they think, well, maybe we don't know about this, we've never paid attention to this, we were never brought it forward, they've had a handle in this for a long time. They have. Mr. Speaker, we have the support of two parties here, and I can say that many grandparents are over there today. You know? I don't know how many, but I'm sure there's a few. Thank you. And I can only put you in you know, put yourselves in the shoes of a grandparent that has lost access to their grandchild. And how much of a turmoil that your life would be in if you didn't have that access. So, Mr. Speaker, in conclusion, I again want to thank the member for Cumberland, for Colchester North, for bringing this issue forward and championing this in our caucus and in Nova Scotia. And all that I can ask is that it be given due consideration in this House and due consideration by the NDP government. And thank you very much for Input Politics this time.
Thank you, and I want to thank all members of the House for their participation in the debate. Chair now recognizes the House Leader for the Progressive Conservative Party.
Thank you very much, Mr. Speaker. And that concludes our Progressive Conservative Opposition Day business. And I'll ask the Government House Leader to inform us of the hours and what we're going to be working on Thursday.
The Honourable the Government House Leader.
Thank you, Mr. Speaker. Mr. Speaker, after question period tomorrow, what we will be doing is going the bills for second reading. Bill 88, Bill 102, 103, 105, 106, 108, 109, 110, and if time permits, Mr. Speaker, we will go in the Committee of the Whole House on bills, and that will be Bill 7, Bill 74, Bill 75, Bill 76, 78, 79, and 81, Mr. Speaker. And I'll ask you to rise. I'll ask you to now rise.
Order, please. Let the man finish.
Speaker, as a fellow said, we're getting there.
We're getting there.
We're getting there. Just relax, everybody. Relax. Take a pill. Chill. Mr. Speaker, I ask you to rise. We'll meet from the hours of 2 p.m. to 8 p.m. tomorrow, Mr. Speaker. Thank you for your kind indulgence.
Thank you. The motion before the host is that we now do rise and meet again tomorrow. The hours between 2 p.m. and 8 p.m. Is the host ready for the question? All those in favor? Against? The motion is carried. We have now reached the moment of interruption. The debate to date is therefore be resolved that all members of the House of Assembly recognize the leadership shown by this government when it made the funding and commitment to the Sydney Harbour dredging project, which will not only greatly enhance the economic activity of the Port of Sydney, but will bolster the shipping industry throughout Nova Scotia as well. And it was submitted by the Honourable Member for Cape Breton Nova, and the Chair recognizes the Member for Cape Breton Nova.
Well, thank you, Mr. Speaker. Mr. Speaker, it's with great pleasure that I rise in the House today to speak to this resolution. Economic growth in Cape Breton is a top priority for my government. This is why we worked so hard since June 2009 to create jobs and invest in the services Cape Breton needs. My government is keeping our commitment to create the secure jobs that Nova Scotians' economy needs by investing in local business, which is why we have committed to funding the Sydney Harbour dredging project. Unfortunately, we are still waiting for a commitment from the federal government to fund their portion. This project would help us to continue to create the secure jobs Nova Scotia's economy needs and keep Cape Breton community strong. It would bring more business here and would give the Port of Sydney a competitive advantage. In addition to the harbour dredging project, we're making the investments in Cape Breton that are needed to ensure young people are able to stay and build a life there. In my constituency of Cape Breton Nova, people told me that we need programs for youth. My government listened and provided Lighthouse funding, a community-oriented crime prevention initiative. The program helps community organizations to create healthier and safe communities by delivering and maintaining effective recreational, educational, cultural, life skills, and after-school programming for youth. Sustainable partnerships among youth, police, government officials, and the community are essential to healthy communities. Communities and individuals must support those who are at risk of being involved in crime in many ways that reduce the likelihood of offending. Lighthouse is one of those initiatives intended to support this. Building strong communities encourages economic growth. This is why we have opened the new community home for adults with disabilities, invested in affordable housing, invested in women's centers and transition houses, and awarded grants to recreation facilities to ensure that Cape Bretoners have access to the services they need. Mr. Speaker, Cape Bretoners told us they needed to access cancer treatment without having to drive to Halifax, and we listened. Cape Bretoners now have the best possible cancer care with the official opening of an expansion of the Cape Breton Cancer Centre in the Cape Breton District Health Authority. Government is committed to providing better health care for families, and the official expansion of the state-of-the-art Cape Breton Cancer Centre will allow the people of Cape Breton to have access to quality care they need as they face one of life's toughest battles. The province invested $4.35 million in the expansion project through funds from the Government of Canada. The $8 million expansion will increase the Cancer Centre's capacity to provide radiation therapy and to allow more people to get more advanced treatment at home in Cape Breton. The commitment and generosity of people in the community has also been most outstanding. And by working with provincial, federal, and community partners, we're making a difference for patients and their families. The people of Cape Breton raised $4.7 million for this project. I am truly impressed and amazed by the generosity of the people of Cape Breton, and I want to congratulate them